We are Nephra, and we are engineering breakthrough preventative care for patients with kidney disease. I want to start the story by introducing you to Robert. Our team met Robert around a year ago today at Carle Hospital here in Champaign. Now, Robert's your run-of-the-mill average guy. He's a retired truck driver from Rantoul in his 60s. But Robert is one of the 786,000 Americans that is suffering from end-stage kidney disease. Robert's kidneys are failing, and he feels helpless. His body isn't able to filter out waste like the rest of us can, and potassium can build up, and it can be very fatal. Now, most people don't know this, but for patients like Robert, the leading cause of death is actually a cardiac event. And these cardiac events are 2 times as likely to occur if a patient has above average potassium levels. Now, we spoke with a dietitian named Joyce Vergili who said that these patients do not have a way to monitor their levels, and that they should. In the same way that a diabetic can monitor their glucose levels, these patients need a way to monitor their potassium levels, but it doesn't exist. But that's why I am really excited to share the floor with Sam, who's going to talk about what we've built here at Nephra.
Thanks, Jonathan. Really what we're engineering at Nephra is peace of mind for patients like Robert. These CKD patients can take handheld ECGs at home, which take anywhere from 30 seconds to a minute. These handheld ECGs are readily available on the market, and as a matter of fact, we've spoken with the manufacturer of these ECGs called Infobionic. Infobionic has expressed interest in going to market with us once we have a solution. In summary, a patient like Robert will take a handheld ECG, and then that ECG signal will go into Nephra software where our algorithms will analyze it. Now, I want you to think of an ECG as a crime scene. Abnormal potassium values will leave a fingerprint on this crime scene, this ECG. Then it's our job at Nephra to detect these fingerprints using feature extraction and machine learning. We've trained our model on a data set from MIT that contains over 100 million ECG samples with paired lab tests. This is a novel approach we designed to create highly precise and highly interpretable insights. As a result, we filed a provisional patent for our approach to this problem. Now, I could not be more excited to work alongside such a talented team of co-founders. Personally, my background is in healthcare data science, where I've worked at Allied Benefit Systems, and machine learning, where I've worked at BP. I'm Nephra's Chief Operating Officer, and I'm so excited for what's in store.
I'm Jonathan Politsky. I'm the CEO. I have experience in healthcare investment banking at Silicon Valley Bank. But more importantly, my grandfather suffers from CKD, and is the reason that I set out on this journey less than 1 year ago today. Now, Suma and Josh aren't here right now, but Suma is a first-year medical student here at Carle Innovation Hospital and spends a lot of time in nephrology research and pushing the fields of AI and has a bachelor's in material science and engineering. Now, Joshua is a computer scientist and bioengineer mix, and he's our CTO. And he's also known for his experience as a CTO of BitCombine, where he's applied much of what he's learned on our job here. Our team has made significant progress despite starting in less than 1 year ago today. Now, we started in June 2021 at Carle Hospital, where we were asking physicians and asking patients what their pain points were. And overwhelmingly, this was the problem that we saw. We then fleshed out our business model in September of 2021, and we were very fortunate to be admitted into the Illinois iVenture Accelerator. From there, we carried that forward and fleshed out our value proposition for the ecosystem in healthcare as a whole, alongside the National Science Foundation, doing customer discovery in ICOR. And in January of this year, we had our first breakthrough, and our team was pumped. Our team, in our first model K1, developed a classification accuracy of 75% and pushed us forward to continue to believe in our vision, and is why we're so confident in ourselves today. Now, moving forward in May, our team is really excited to announce that we're going to be working full-time on this project. We're also going to be flying out to Austin, Texas to collaborate alongside CVS Kidney Care and mitigating the problems we see in the space today. For the next steps, when our model achieves an accuracy or clinical efficacy of 0.89 to 0.9 AUC, we are going to formalize our partnership with Infobionic. At this point, we will be calibrating our model to their hardware and going to the FDA as a Class 2 software as a medical device. In that meantime as well, we will also be collecting letters of intent with research hospitals that you can see on the right. Now, these from our customer discovery tend to be the ones that are the most interested in innovation, healthcare and personalized dialysis, which is the next wave of healthcare in dialysis and what we fall in line with. Specifically, Mayo Clinic is actually a partner with Infobionic and has really mentioned its ability to use data, patients, and in our initial trials. The reason that this is important, not just for patients, but for hospitalizations and Medicare as a whole, is that these patients within the current standard of care experience 8 days of increased hospitalization every month. Now, each of these hospitalizations is $38,000. And so if we can cut these in half, we can save payers over $4.8 billion. We fall under remote patient monitoring CPT codes for an annual reimbursement of $763. And this qualifies also for, this falls in line with a 96% contribution margin, which really pushes for strong operating leverage and scalability. Thank you. We are Nephra, and we are really excited to be pitching you today. We've had a great time seeing all the pitches, and yeah, looking forward to the award ceremony.
Thanks.